Good morning, APOSI SSG peeps. Welcome back to our Wellness Wednesday webinar. So our topic for today is about bronchial asthma. So we have a lot of types of asthma. However, we will be focusing on the bronchial asthma. So what are the discussion outline? So we have the definition, signs and symptoms, causes, triggers, diagnosis, treatment, and prevention. So, what is a bronchial asthma? So, it is a chronic inflammatory disease of the airways that causes periodic attacks of coughing, wheezing, shortness of breath, and chest tightness. So, when you say chronic, it means to say itong asthma na to is more than 3 months na siyang inaatake. And then, what are the symptoms? So, we have the shortness of breath, chest tightness or pain, wheezing when exhaling, trouble sleeping, coughing or wheezing. Sometimes during sleeping, magkakaroon ka din ng wheezing sound. So para kang sumisipol while you are sleeping. And then what are the causes? So number one, genetic of course. Kapag yung parents mo mayroong asthma, then 100% ikaw na anak meron kang asthma. So we have allergic reactions. If you can still remember last week, as I have mentioned, kapag meron kang allergic rhinitis and then meron kang asthma, both pwede siyang mag-trigger. And then environment, and then respiratory tract infection, excessive physical activity, and exposure to chemicals. It's because kapag naglilinis ka sa bahay, especially bleach, and may asthma ka, you are not allowed to use bleaching chemicals. It's because matitrigger yung asthma mo. So, asthma signs and symptoms flare up in certain situations. So, sometimes mag-exacerbate siya. So, pwede siyang lumala kapag exercise-induced asthma yung cause or allergic-induced asthma or occupational asthma. So it's work-related asthma naman. So what are the triggers? So we have airborne allergens, respiratory infections, mga physical activity, cold air. Kapag nag-weather change tayo, pwedeng atakin ka ng asthma. Air pollutants and irritants, pwedeng medications. Strong emotions and stress, lalo na kapag prolong yung lack of sleep, pwede din yon. Sulfites and preservatives added to some types of foods and beverages, and gastroesophageal reflux disease or GERD. So what are the diagnostics tests na ginagawa? Usually, ang gumagawa nito is pulmonologist. So they want you to undergo spirometry. So yung spirometry, magbo-blow ka ng specific amount of air from your lungs and then imi-measure kung hanggang saan aabot yung tatlong balls na yan yung level ng floating niya. And then from there, ida-diagnose ng doctor if you have or nag-exacerbate na ba yung asthma mo. And then the peak flow, so you still have to breathe also on air coming from your lungs. So titingnan din kung ano yung range ng peak flow mo. And then from there, saka mag-rule out si doctor if it's an asthma or bronchitis or pwede siyang mag-level up into community-acquired disease na respiratory. And then chest x-rays, of course, the doctor will check if affected yung mga bronchioles or meron bang mga inflammation or yung lungs mo covered na ba with phlegm. So yun yung diagnostics test na ginagawa ng mga pulmonologists or ng mga internal medicines. So what are the treatments? So number one, we have to do the breathing exercises. So minsan kasi yung paghinga natin hindi na siya fully effective. So we have to do breathing exercises. It also contributes to at least expel also kung ano yung mga phlegm na nasa loob or mga discharges sa loob ng lungs. So you have to do a simple inhale and exhale lang with a fresh air naman, wag naman sa mga polluted area. And then for quick acting treatments, so of course, you can use ginagamit natin for nebulizer and nebulizer kit. Kailangan personalize yan. It's because gagamitin mo yan, pwede mo siyang ilagay sa ilong, pwede mo siyang ilagay sa bunganga. So it should be hygienic. And then long-term asthma control medication. So bibigyan ka ng puff ng doctor. So per patient mayroon specific combination ng gamot or puff for asthmatic patient, but sometimes yung mga doctors hindi nagbibigay ng puff. Minsan nagbibigay lang sila ng mga tablets to at least alleviate right away yung asthma attack. So pwedeng Ventolin tablet ang ibibigay, and then sasabayan siya ng nebulizer para right away makita yung effect ng treatment na ina-undergo ni patient. And then for preventions, of course, number one, we have to follow the doctor's recommendation. So sometimes pinagbabawalan tayong kumain ng mga hairy fruits like mango, pinya, hindi po pwede yan sa mga asthmatic. And then you have to get vaccinated kasi it helps also to prevent you from getting pneumonia. And then identify and avoid asthma triggers. So kung yung trigger ng asthma mo is na-listed earlier, you have to avoid those para hindi mag-exacerbate yung asthma. And then you have to monitor your breathing, so you can use spirometer, can use the pulse oximeter, pwede yun kasi it will measure kung ilang percentage yung oxygen level na meron sa lungs natin. And then identify and treat attacks early. So kapag napapansin nyo lalo na sa weather, kapag medyo maulan, lalamig, iinit, pag may mga abrupt weather changes, so you have to bring your emergency drugs for asthma, especially the puff para kapag atakihin ka, pag start pa lang, meron ka ng medication. Of course, you have to take your medication diligently kasi kapag hindi mo siya tinake with the proper guidance also ng doctor, there's a tendency na hindi ka ma-relieve and your asthma attack will exacerbate or mag-level up siya into bronchitis. So, you have to remember asthma can't be cured but its symptoms can be controlled because asthma often changes over time. It's important that you work with your doctor to track your signs and symptoms and adjust your treatment as needed. So you have also to take care of your lungs since this is part of our respiratory system. So that's all for our bronchial asthma. Thank you for your time, guys, and have a great day. See you on our next wellness webinar. Bye.